Mental health affects us all, whether you suffer yourself or know somebody who does. Over the past 10 years, there's been a 30% increase in sectioning under the Mental Health Act. I went to Mind in Southampton to find out more.
Well, people are sectioned under the Mental Health Act, as it gets said, when they are either a danger to themselves or to other people and they have a mental health issue. In a sense, it doesn't matter what your diagnosis is, but if you need hospital care, psychiatric hospital care, and it would make more sense for you to be there in hospital and safer for you to be in hospital, then you may get sectioned under the Mental Health Act.
The government may have pledged to do more to support people with mental health issues, but with an increasing amount of people seeking and needing help, are there going to be enough resources to cope?
Across the country, the number of available bed spaces for mental health patients has gone down by about the same proportion as the number of sections has gone up. And one of the things that a lot of people think is happening is that people are being sectioned for beds. So in other words, you've got a better chance, if you're a consultant psychiatrist, you've got a better chance of getting a bed for your patient if they are sectioned. The mental health services generally have been under huge pressure over the last few years. And although NHS funding should have held up over the last period of time, it hasn't actually in real terms. But it's not only NHS funding that people with mental health issues depend on. Local authority funding is arguably at least as important. So all the preventative social care investment that should stop people needing to go into hospital, that's been cut back, and it's been cut back a lot over the last 4 or 5 years. Back in about 2012, 2013, the local trusts took the decision to go from about 150 bed spaces in Southampton and across Hampshire to just over 100 bed spaces. So fairly serious cut in the number of bed spaces and in the available services for people with mental health issues. Now, they were very sure that they'd done their sums right, they'd got their calculations right at the time, but it's now clear that they didn't.
What's the science behind mental health and sectioning? I got insight from psychologist and lecturer Nick Maguire.
So if there's a clear diagnosis and then a clear treatment, and that treatment is going to be useful to be provided in an inpatient setting, and somebody perhaps is at threat to maybe others or themselves, or harm may come to themselves or others, then maybe being sectioned might be useful. In other words, having your liberty withdrawn and having to go to a hospital. So we know that structural and societal problems like poverty can impact on mental health incidence rates. So you might get, in times of economic difficulties, you might get increases in things like anxiety and depression. And some of those may reach the state to which somebody may need to be sectioned because they are a threat of harm to themselves, usually. So one of the factors is mental health incidence rates of mental health problems, but that's complicated, and it often depends on diagnoses and also societal problems.
Understanding mental health is key in medical and personal support. So if you have any questions regarding your own or someone else's well-being, professionals are there to help. April Brown, Solent News Now.